Thank you for joining me as we discuss Chapter 11, the Respiratory System. Let's get started. Lesson 11.1, Anatomy and Physiology of the Respiratory System. We will recognize and use terms related to the anatomy and physiology of the respiratory system. Functions of the respiratory system. Oxygen is taken in and carbon dioxide is breathed out during respiration. On the route to the lungs, the air is filtered, warmed, and humidified. The respiratory system also assists in the regulation of the acidity and alkalinity of blood. Let's decode and define each term, noting that re, meaning again, refers to the in, meaning in, and ex, meaning out nature of breathing. Inspiration, therefore in, our prefix means in. Spiro means breathing. Inhalation, again, in means in, halo means breathing. Expiration and exhalation both have the prefix ex, which means out. Note that the S of spiro is dropped because of the X providing the sound of the S. Why does the phrase, the patient expired, mean more than simply the patient breathed out? That's because there is no following inspiration. Remember, air also takes a role in sound in speech and olfaction, which means our ability to smell. So think about it. Can you speak or say a word without using your lungs? Nope, it's needed. Specialty and the specialist. The study of the lungs is pulmonology, and the specialist is called the pulmonologist. Remember, logi is the study of, and logist is the one who studies. Anatomy and physiology. Let's review singular plural endings for pharynx, turning to pharynges, larynx going to larynges, and bronchus going to bronchi. Be careful! Don't confuse bronchio, which means bronchial tubes, with brachio, which means the arm. Internal respiration is the exchange of oxygen and carbon dioxide between the tissues of the body, whereas external respiration is the exchange of oxygen and carbon dioxide between the external environment and the lungs. The upper respiratory system encompasses the area from the nose to the larynx. Air can enter the body through the mouth, but for the most part, it enters the body through two nares, also known as nostrils, of the nose that are separated by a partition called the nasal septum. The hairs of the nose serve to filter out large particles of matter, and the mucous membrane and the cilia, which are those small hairs of the respiratory tract, provide further means of keeping air clean, warm, and moist as it travels to the lungs. The cilia continually moves in a wave-like motion to push mucus and debris out of the respiratory tract. The air then travels up and backward, where it is filtered, warmed, and humidified by the environment in the upper portion of the nasal cavity. Again, let's review from the previous slide. The nares are the nostrils, the nasal septum is the wall between the nares, and the cilia are the small hairs that line the respiratory tract. The hairs in the nose help filter air as it enters the nose, whereas the mucous membranes in the cilia are a means of keeping the tract clean, warm, and moist as air moves through the nasal cavity. The olfactory receptors are located in the nasal cavity. Now let's talk a bit about the paranasal. Remember, para is our prefix meaning near. So the paranasal sinuses are those cavities in the bone that are near the nose. Each of the four sinuses acquires its name from the bone in which it is located: the frontal, the maxillary, the sphenoid, and the ethmoid. Be careful, the plural of sinus is sinuses, not sini like our plural rules would suggest. The throat is divided into three sections. The nasopharynx is directly behind the nose. The eustachian tube, which connects the ear to the throat, opens here. This is the site also of the pharyngeal tonsils, known as the adenoids, which consists of lymphatic tissue that helps prevent pathogens from entering through this opening. Be careful! The combining form salpingo means both eustachian tubes and fallopian tubes. Then we have the oropharynx. That is the part of the throat that is directly behind the oral cavity. Remember, oro is our combining form for mouth. The palatine tonsils are the lymphatic tissues that guard this opening. Then we have the laryngopharynx, also called the hypopharynx. This is part of the throat that is below the oropharynx and is close to the voice box, which is the larynx. The larynx is the location of the vocal cords, which vibrate to produce speech as air passes back through an opening in the larynx. The epiglottis is a flap of cartilage at the opening of the larynx that closes access to the trachea during swallowing so that food is routed to the esophagus and kept from entering the trachea. Remember, the layman's term for trachea is windpipe. You can find this image in your book on page 411. The respiratory system is anatomically divided into the upper respiratory tract, which we just reviewed, and the lower respiratory tract, which includes the trachea, bronchial tree, and the lungs. Physiologically, it is divided into conduction passageways and gas exchange surfaces. Let's review that previous slide again. So, the lower respiratory system begins with the windpipe, which extends through the mediastinum, which is known as the space between the lungs. You can see it here with the purple dot on this image. The trachea bifurcates, which means it divides into two branches at the carina, and becomes a right and left bronchi. The bronchi divide into smaller and smaller branches called bronchioles, which end in microscopic ducts capped by air sacs called alveoli. Singular form of this term would be alveolus. Each alveolus is in contact with a blood capillary to provide a means of exchange of oxygen and carbon dioxide. Each alveolus is coated with a substance called a surfactant that keeps the sac from collapsing. The lungs are composed of sections called lobes. The right lung has 3 lobes, whereas the left lung only has 2 lobes. Why do you think that is? Well, if you guess it's to make space for the heart, you'd be correct. The lungs are enclosed in a double-folded serous membrane called a pleura. The side of the membrane that coats the lungs is the visceral pleura. Remember, viscero is our combining form for organ, whereas the parietal pleura is the side that is closer to the body wall. The two sides of the pleural membrane enclose a small amount of fluid that serves to reduce friction and facilitate the contraction and expansion of the lungs. The muscles that are responsible for respiration are the diaphragm, a large flat muscle that is located between the thoracic and abdominal cavities, and the intercostal muscles. Remember, inter means between, costo means rib. These are muscles which are the muscles between the lungs. Lesson 11.2, Pathology of the Respiratory System. We'll recognize and use terms related to the pathology of the respiratory system. Let's review some terms related to respiratory symptoms. Aphonia, remember, this comprises of the prefix a meaning without. Phono is our combining form for sound. This is a loss of the ability to produce sound. Dysphonia, remember, dis is our prefix meaning difficult. So a term used to discuss the condition of hoarseness, which is difficulty in making sound. Then we have Cheyne-Stokes respiration is deep, rapid breathing followed by a period of apnea, which is a temporary lack of breathing. Then we have clubbing, and this is the abnormal enlargement of the distal, remember distance, distal, it means the far ends, of the phalanges as a result of diminished oxygen in the blood. Then we have cyanosis. Remember, cyano is our combining form for blue, the color blue. This is a discoloration of the skin and mucous membrane caused by insufficient oxygenation of the blood. The color of the skin, nail beds, and or mucous membranes may be blue, as the term would describe, or a gray or slate or even a dark purple. Note that the blueness may appear as a gray in shade in different shades of skin. Also note that it can be seen in nail beds and gingivae, which are the gums. And then lastly we have epistaxis, and this is the medical term for a nosebleed. Here we have hemoptysis. Now the suffix tysis, which I will put up here, means spitting, and this is when there is coughing up of blood or blood-stained sputum. Then we have hypercapnia. Hyper means excessive, that's our prefix for excessive, and then capno is our combining form for carbon dioxide. It is the condition of excessive amount of carbon dioxide in the blood. Hyperventilation is normally increased breathing, whereas hypoxemia, remember hypo is our prefix for deficient, oxo is our combining form for oxygen, and then emia is blood condition. Please remember that emia is blood condition. It's not blood, it's not condition, it's blood condition. Which means hypoxemia is a condition of deficient oxygen in the blood. Hypoxia, however, is a condition of deficient oxygen in the tissues. Then, lastly, we have pleurodynia, which is pain in the chest as a result of inflammation of the intercostal muscles. Let's look at some more terms related to the respiratory system. So first we have pyrexia, which is the medical term for fever. Many of you may have heard of the combining form pyro before. Pyro means fire. Then we have rhinorrhea. Rhea is our suffix for discharge or flow, and this is a discharge from the nose. What's the common name for rhinorrhea? It's a runny nose. Shortness of breath is a term for breathlessness or air hunger. And sputum is the mucus that is coughed up from the lungs and expectorated through the mouth. If abnormal, it would describe in terms of its amount, color, and or odor. Then we have thoracodynia. So thoraco is our combining form for chest, and dynia means pain. Therefore, this term is for chest pain. All right, now each of these terms ends with the suffix penia, which means breathing. Therefore, dyspnea is an abnormal, difficult, or uncomfortable breathing. Eupnea, our prefix EU, is good or normal. So this is good normal breathing. Then we have apnea. Remember, A as a prefix is our no, not without. So this means a temporary lack of breathing. If it was permanent, the patient would have expired. Then we have bradypnea. Remember, brady is our prefix for slow. So this is abnormally slow breathing. Then we have hyperpnea. Hyper is our prefix for excessive, and this is an excessive deep breathing. Then we also have the opposite, which is hypopnea. Remember, hypo means deficient, so this is extremely shallow breathing. Then we have orthopnea. Ortho, think of when you go to an orthodontist, right, to get braces to straighten your teeth, or if you use orthotics to straighten your posture. So ortho is our combining form for straight. It is a condition of difficult breathing unless the patient is in an upright position. And then lastly, we have tachypnea. So tachy, remember, means that rapid or fast. So this is a rapid, shallow breathing. Which term is normal? Eupnea. Now let's look at some terms related to abnormal chest sounds. So friction sounds are those that are made by dry surfaces rubbing together. A hiccup is a sound produced by the involuntary contraction of the diaphragm, followed by rapid closure of the glottis, which is the opening between the vocal cords. Rails, which is also called crackles, are discontinuous bubbling noises. Bronchi are abnormal rumbling sounds caused by airways blocked by secretions or muscle contractions. Then we have stridor, is a high-pitched inspiratory sound from the larynx. It is a sign of an upper airway obstruction. Then we have chest tympany, which is a low-pitched, resonant sound heard in the chest. And finally, wheezing, which is a whistling sound made during breathing. Now let's look at some terms related to disorders of the upper respiratory tract. First here we have coryza, which is the term for the common cold. Croup is an acute viral infection of early childhood marked by stridor caused by spasms of the larynx, trachea, and bronchi. A deviated septum is a deflection of the wall between the nares that may obstruct the nasal passages. It may cause infection, sinusitis, shortness of breath, headache, or reoccurring epistaxis. Remember, that's a nosebleed. Then we have epiglottitis, which is the inflammation of the epiglottis. Then we have laryngitis, which is inflammation of the larynx, and pharyngitis, which is the inflammation of the throat. Remember, throat is our layman's term for the pharynx. Next, we have obstructive sleep apnea, which is a temporary lack of breathing that occurs during sleep when the posterior pharynx relaxes and covers the trachea. Nasal and vocal polyps are small tumor-like growths that project from a mucous membrane. They can occur in the nose, sinuses, or vocal cords. Rhinitis is the inflammation of the nose, and rhinomycosis is an abnormal condition of fungus in the nose. Remember, myco is our combining form for fungus. Don't get myco confused with myo or myel. Myo means muscle, myelo means the spinal cord or spine. Then we have rhinosalpingitis, which is an inflammation of the nose and the eustachian tubes. Lastly, we have sinusitis, which is an inflammation of one or more of the paranasal sinuses. Then on this last section, we have tracheomalacia. Malacia is our suffix for softening. Therefore, this is a softening of the tissue of the trachea. And then we have tracheostenosis. Now, stenosis is a suffix meaning narrowing. Therefore, this is a narrowing of the trachea. And then lastly, we have an upper respiratory infection, commonly called a URI, and it is an inflammation and or infection of the upper respiratory tract. Now that we've covered the upper respiratory tract, let's look at some terms related to disorders of the lower respiratory tract. So first we have asthma, which is a respiratory disorder that is characterized by recurring episodes of proximal, which means sudden or episodic, dyspnea. Remember, that's the difficulty breathing. Patients exhibit coughing, wheezing, and shortness of breath. If the attack is continuous, it is referred to as a status asthmaticus, which may be fatal. Then we have bronchospasm. Remember, spasm is our suffix for sudden involuntary contraction. Remember, this is a sudden involuntary contraction of the bronchi, as in an asthma attack. Then we have bronchiolitis, which is a viral inflammation of the bronchioles, most common in young children. Then we have bronchitis, which is inflammation of the bronchi that may be acute or chronic. Then we have bronchiectasis. Ectasis is our suffix meaning dilation. This is a chronic dilation of the bronchi. Then we have chronic obstructive pulmonary disease, also known as COPD, and this is a respiratory disorder characterized by a progressive and irreversible diminishment in the inspiratory and expiratory capacity of the lungs. Patients experience dyspnea on exertion, known as DOE, difficulty inhaling or exhaling, and a chronic cough. Then we have emphysema, which is an abnormal condition characterized by distension and destructive changes of the alveoli. Then we have acute respiratory failure, which is a sudden inability of the respiratory system to provide oxygen and/or remove carbon dioxide from the blood. Then we have cystic fibrosis, which is an inherited disorder of the exocrine glands of the lungs, resulting in abnormal thick secretions of mucus. Then we have atelectasis, which is a collapse of a lung tissue or an entire lung. Remember, A means not, telo is a combining form meaning complete, and ectasis again is dilation. Then we have flail chest, which is a condition in which multiple rib fractures cause an instability in part of the chest wall. Because of this, the lung under the injured area contracts on inspiration and bulges out on expiration. Influenza is the term for the infectious condition of the respiratory system caused by a virus. This is commonly called the flu. The avian bird flu is caused by the type A influenza virus. Then we have diphtheria, which is a bacterial respiratory disorder characterized by sore throat, fever, and a headache. It is one of the diseases for which a vaccination is available, the DPT vaccine, which is known for diphtheria, pertussis, and tetanus. Then we have pertussis, which is also called whooping cough. It is a bacterial infection of the respiratory tract characterized by a high-pitched whoop. This is also avoidable via the DPT vaccine. The suffix thorax literally means the chest, but in the following terms it refers to the pleural cavity. Hemothorax is blood in the pleural cavity. Pneumothorax, remember pneumo means air, this is air in the pleural cavity. And then we have pyothorax. I always say we don't like pie in medical terminology because pyo means pus. So this is pus in the pleural cavity. Anybody think of any other term that could be used for pyothorax? Maybe empyema, that's another one. A pleural effusion is an abnormal accumulation of fluid in the intrapleural space. Pleurisy, you may hear this term referred to often in the field, is inflammation of the parietal pleura of the lungs. It may be caused by cancer, pneumonia, or tuberculosis. Then we have pneumoconiosis. Pneumo means lung, coni means dust, and is a loss of lung capacity caused by the accumulation of dust in the lungs. Asbestosis is an abnormal condition of asbestos in the lungs. Silicosis is an abnormal condition of glass dust in the lungs, and anthracosis is an abnormal condition of coal dust in the lungs. Anthracosis is another name for coal workers' pneumoconiosis, CWP. The lungs appear black because of the massive deposits of carbon particles. This gave way to it being called black lung disease as well. Any particulate matter can result in this disease when the respiratory system is unable to filter the air adequately to protect the lungs. Pneumonia is an inflammation of the lungs caused by a variety of pathogens. If infectious, it is termed pneumonia. If it is non-infectious, it is termed pneumonitis. Pneumonia is further named for the extent of the disease. For example, RML pneumonia is right middle lobe pneumonia, whereas double pneumonia is the involvement of both lungs. Pulmonary abscess is a localized accumulation of pus in the lungs. Pulmonary edema is the accumulation of fluid in the lung tissue. This is often seen in congestive heart failure and is caused by the inability of the heart to pump blood. Then we have respiratory syncytial virus, also known as RSV, and this is an acute respiratory disorder usually occurring in the lower respiratory tract in children and the upper respiratory tract in adults. Then we have severe acute respiratory syndrome, also known as SARS. This is a viral respiratory disorder caused by a coronavirus. It usually results in pneumonia. And then we have tuberculosis, also known as TB. This is a chronic infectious disorder caused by an acid-fast Bacillus Mycobacterium tuberculosis. It is normally transmitted by inhalation or ingestion of infected droplets. Then we have multi-drug resistance TB, or MDR TB. This is fatal in 80% of the cases. Now we'll review some terms related to benign neoplasms. First, we have a pulmonary hamartoma, which is a benign tumor of limited abnormal tissue formed in the respiratory tract. Hamarto is a combining form meaning a defect. A mucus gland adenoma is a benign tumor of the mucus gland in the respiratory tract. And a papilloma is a benign tumor of epithelial origin in the respiratory tract. It is named for its nipple-like appearance, hence the combining form papillo, which means nipple. Now let's look at some terms related to malignant neoplasms. Remember, malignant means cancerous. First, we have mesothelioma, which is a rare malignancy of the pleura in the respiratory system and other productive tissues that cover the internal organs of the body. This is often caused by asbestos. Much more common is the group of non-small cell lung cancers. These are most often caused by smoking, secondhand smoke, radon, asbestos, and air pollution. So first we have adenocarcinoma, which is derived from the mucus secreting glands in the lungs. Then we have large cell carcinoma originating in the lining of the small bronchi. And then squamous cell carcinoma originates in the squamous epithelium of the large bronchi. Then we also have small cell lung cancer, also called oat cell carcinoma. This is the second most common type of lung cancer. This cancer originates in the neuroendocrine cells in the bronchi and is most often caused by smoking. Age matters. So as we can see with pediatrics, we have pneumonia caused by RSV, asthma, and acute bronchitis. Geriatric patients, we have pneumonia, pulmonary edema, COPD, respiratory failure, and cancer. Quick question. Pulmonary edema is often present in which cardiac disorder? We just had this on the last chapter. If you said congestive heart failure, give yourself a pat on the back. Great job. Lesson 11.3, Diagnostic Procedures and Therapeutic Interventions for the Respiratory System. We will recognize and use terms related to the diagnostic procedures and the therapeutic interventions for the respiratory system. Alright, let's look at some terms related to diagnostic procedures. First, we have auscultation, which is the act of listening to sounds within a patient's chest, whereas percussion is the tapping of the body walls. Don't confuse the abbreviation A&P with the same that is used for anatomy and physiology. If no sounds are heard in the chest that would indicate fluid or exudate, the patient is said to be clear to auscultation, abbreviated CTA. Further examination of the chest by listening may be accomplished by the use of a stethoscope. Remember, stetho is our combining form for chest. Note that the suffix scope, which normally means an instrument to view, is used to indicate an instrument to listen in this one example. Think of the word see more as reveal, so we're revealing it with auditory review. Each of the following are endoscopic procedures, that is, procedures that require an instrument to view within the body. Pictured here is a bronchoscopy, which is the process of viewing the bronchial tubes. The laryngoscopy is the process of viewing the interior of the larynx, which we know as the voice box. Then a mediastinoscopy is the process of viewing the structures contained between the lungs. And lastly, a thoracoscopy is the process of viewing the entire chest cavity. PFTs, or pulmonary function tests, are those procedures that determine the capacity of the lungs to exchange oxygen and carbon dioxide efficiently. One measure, for example, is the FEV, or the forced expiratory volume. This is the amount of air that can be exhaled with force in one breath. The table in your book gives you several more examples. Then we have spirometry. Spiro is our combining form for breathing or breath, and metry is that process of measurement. So this is one of the pulmonary function tests to measure the air capacity of the lungs with a spirometer. Remember, meter is our suffix for instrument used to measure. Remember, metry ends with that Y, which means there's a process, there's something happening. So that's the process of measuring. So therefore, this is the instrument to measure breathing. I did put a little image of Spyro the dragon at the bottom. Remember, he flies through the air. Kind of think of that. He breathes fire. Maybe that'll help. I don't know. I tried. All right, and then a peak flow meter is another instrument used to test pulmonary function by measuring breathing capacity. These devices are often used by patients to monitor their breathing capacity, whereas a spirometer can be used for a wider range of testing by a physician. One of the most common diagnostic imaging procedures for this system is the chest X-ray. It may be enhanced by contrast medium to image the flow of blood through the pulmonary vessels in the pulmonary angiography. Remember, angio is our combining form for vessel. Then we have a computed tomography, which is an imaging technique that creates cross-sections or slices of tissue. Then we have magnetic resonance imaging, which uses radiofrequency pulses to detect lung tumors and embolisms to determine the extent of chest trauma. Then lastly, we have sonography, which is the use of high-frequency sound waves to image structures within the body. Both of these procedures use radiopharmaceuticals, known as nuclear medicine, to produce an image. A lung perfusion scan is done to visualize blood flow in the lungs and is useful in detection of pulmonary embolisms. A lung ventilation scan shows how air is distributed in the lungs and measures the ability of the lungs to take in air. Arterial blood gases, or ABGs, is a blood test that measures the amount of oxygen and carbon dioxide in the blood. Note that this is one of a very few tests in which blood is taken from an artery instead of a vein. Then we have pulse oximetry. Remember, oxy is our combining form for oxygen, and metry is that process of measurement. So this is a simple, non-invasive test that is done to measure oxygen in arterial blood. It is done through the use of a clip-like device attached to either an earlobe or the fingertip. Be careful. Don't confuse combining form oxy, which means oxygen, with the prefix oxy, O-X-Y, meaning rapid. Then we have the Mantoux skin test, which is an intradermal, remember intra means within, it's an intradermal injection to purified protein derivative, also known as PPD, that is done to detect the presence of tuberculosis antibodies. Then we have the quantiferon TB gold test, which is a definitive test to diagnose tuberculosis. A sputum culture and a sensitivity is the cultivation of microorganisms from the sputum that has been collected from expectoration. Remember, ex is our prefix meaning out. Pectoro means chest, so this is out from the chest. Then a throat culture is the cultivation of microorganisms from the throat swab to determine the type of organism causing a suspected infection of the throat. Lastly, we have a sweat test, and it is a method of evaluating the concentration of sodium and chloride in the sweat as a means of diagnosing cystic fibrosis. Now let's review some therapeutic interventions. A ventilator is a mechanical device to provide oxygen through positive pressure breathing. This is a respiratory therapy technique designed to deliver air at greater than atmospheric pressure to the lungs. Then we have continuous positive airway pressure, also known as a CPAP, is another method of delivery. Air can be delivered through a ventilator and endotracheal tubes, nasal cannulae, face masks, or hoods over the patient's head. Next, we will examine the types of devices used for oxygen delivery. A nasal cannula is a set of pronged tubes inserted into the nostrils and is used to deliver a low level of oxygen. A simple face mask is a plastic device that covers the nose and mouth and is used to deliver oxygen. A venturi mask is similar but has much larger tubes that connect the oxygen source to the mask. And then a rebreathing mask is used if higher oxygen levels are needed. This again is similar to a face mask, but has one-way valves that allow for little or no rebreathing to take place so that the patient can have clear, richer, continuous oxygen supply. Now we're going to review terms related to therapeutic interventions. Each of these terms describes the removal or resection of a particular structure in the respiratory system. First, we have an adenoidectomy, which is the removal of the palatine tonsils, also known as the adenoids. Then we have a laryngectomy, which is the removal of the larynx or the voice box. Then we have a tonsillectomy, which is the removal of the pharyngeal tonsils. Those are the ones we simply call the tonsils. A lobectomy is the removal of one of the lobes of the lungs. Remember, there are 2 on the left and 3 on the right. Then we have a pneumonectomy, which is the removal of part or all of the lung. Now let's look at some surgical repairs. Remember, plasty is our suffix meaning surgical repair. So a bronchoplasty is a surgical repair of a bronchial defect. Rhinoplasty is a cosmetic or surgical repair of the nose. And then we have a septoplasty, which is the surgical repair of the wall between the nares. Next we have endotracheal intubation. Remember, endo means within. So this is the passage of a tube through the mouth into the trachea to ensure a patient has an open airway. Then we have thoracentesis, also called pleurocentesis, which is surgical puncture of the pleura to aspirate fluid. Then a thoracotomy is the incision. Remember, tomy is our suffix meaning incision into. So this is an incision into the chest as a means of approach for surgery. Then we have sinusotomy, which is an incision into a sinus. Then next we have tracheotomy, which is an incision into the trachea, whereas a tracheostomy is a new opening through which an indwelling tube may be inserted temporarily or permanently. The tracheotomy is usually an emergency procedure to gain access to the airway. And finally, let's wrap up with some pharmacology. So ventilators are devices that serve to assist respiration and intensive positive pressure breathing. Handheld nebulizers are devices that convert liquids into a fine spray, such as inhaled medications. An inhaler is a device for administering medications that are inhaled, such as vapors or fine powders. A spacer is a device connected to the inhaler that contains the mist expelled from the inhaler until the user can breathe it. Antihistamines are drugs that block histamine receptors to manage allergies. Examples are Tavist, Benadryl, Claritin, and Allegra. Antitussives are drugs that suppress the cough reflex. Example would be like Delsum or Robitussin AC. Bronchodilators are drugs that relax the bronchi to improve ventilation to the lungs. Examples include albuterol and Atrovent. Decongestants are drugs that reduce congestion or swelling of the mucous membranes. Example of this would be pseudoephedrine or Sudafed PE. Expectorants are drugs that promote the expulsion of mucus from the respiratory tract. An example of this would be Mucinex. Inhaled corticosteroids are drugs that reduce airway inflammation to improve ventilation via nasal or oral inhalation. Examples of this would be like Flovent, Flonase, Nasonex. Then we have mucolytics, which are drugs that break up thick mucus in the respiratory tract. An example of this would be Mucomyst. Alright everyone, that's all I have for you today. Thank you so much for joining me. I wish you nothing but the best. Remember, you can always feel free to reach out. Once you're my student, you're always my student. Thank you and have a great one.